That itch that won't leave you alone. That urine that suddenly changes color. These seem like details, don't they? But what if I told you that they could be silent screams from your body? What if your pancreas, an organ that works quietly, was trying to warn you of a mortal danger, an enemy that approaches without making a sound? In the United States, it is estimated that there are around 11,000 new cases of pancreatic cancer per year, and many, unfortunately, are only discovered too late. Keep watching, because recognizing these signs can be the difference between life and death. Hello, everyone. Before we dive into a serious topic that can really save lives, tell us, from which corner of the United States or the world are you following us today? Leave your comment below. And if you believe in the power of information to protect your health, take the opportunity to subscribe to our channel and activate the bell. That way you won't miss any vital content like this. Today, our focus is on pancreatic cancer. Let's unravel the signals it sends, messages that are often so subtle that they seem like a desperate whisper for help. Think of the pancreas, an essential gland, working quietly behind the scenes in our bodies, way back in the stomach, orchestrating our digestion and releasing crucial hormones like insulin. But when cancer decides to take hold there, it becomes a sneaky adversary, an enemy that doesn't announce its arrival. The symptoms? Oh, they can be masters of disguise, easily confused with the mishaps of everyday life. And that's exactly why we need to become attentive detectives, learning to decipher these silent screams before it's too late. Just imagine the anguish of ignoring a minor discomfort, only to discover, months later, that it was your body crying out for help against such a devastating disease. Pancreatic cancer is one of the tumors with the highest mortality rates, precisely because, in many cases, it is only diagnosed in advanced stages, when treatment options are already more limited. But what if you had the knowledge to identify the warning signs earlier? What if you could act before the disease advances stealthily? This knowledge is power. It is your best defense. In the next few minutes, we're going to look at 7 of these signs. 7 warnings that your pancreas may be sending you. Some of them may seem harmless on their own, but together, or if they persist, they form an urgent call to seek medical help. Our intention is not to cause panic, by any means, but rather to arm you with vital information. Information that may encourage you to talk to your doctor, to investigate and, who knows, lead to an early diagnosis, which means a much more favorable prognosis. Pay close attention, write down if you think it's necessary, and remember, your body speaks. Learn to listen to it. Sign 1: Yellow skin and eyes, jaundice. The first sign, and perhaps one of the most characteristic when it finally decides to appear, is jaundice. You know that yellowish color that can appear on the skin and in the whites of the eyes, as if a sepia filter had been applied to your worldview? That's jaundice. And why does it happen when there's a storm brewing in the pancreas? Imagine the pancreas, our silent worker, strategically located near the bile duct. Think of it as an important channel, a highway that carries bile, the essential liquid for digesting fats, from the liver straight to the intestine. Now, imagine a tumor growing right in the head of the pancreas, the region closest to this pathway. Like an unexpected obstacle on the road, it can compress or even completely block the passage. When bile cannot flow normally to the intestine, a dark yellow pigment called bilirubin, which is part of the bile and should follow its course, begins to accumulate in the blood, like a dammed river. This excess bilirubin is what deposits itself on the skin and eyes, causing the yellowish coloration. It's a visual warning from your body, a sign that something is blocking a vital pathway. There may be no pain at first, just a subtle but unmistakable change in color. Jaundice is often the first symptom that triggers a warning and prompts a person to seek medical attention. In cases of pancreatic cancer, it may be confirmation that the tumor is interfering with the flow of bile. It's a sign that cannot be ignored under any circumstances. If you or someone you know notices a yellowish tint to their skin or eyes, the advice is clear: see a doctor immediately. It's not just a matter of appearance, it could be a vital warning from your pancreas. In addition to yellow skin and eyes, jaundice can be accompanied by other accomplices, signs linked to this bile obstruction, which we will explore shortly. But remember this image: jaundice, in itself, is already an urgent call to action. It is your pancreas, or neighboring organs, feeling the impact, waving a red flag that something serious is going on and needs to be investigated without delay. Sign 2. Dark urine and light-colored stools. Closely linked to the drama of jaundice and biliary obstruction comes the second warning sign: a change in the color of your urine and stool. If your urine suddenly takes on a persistent dark hue, reminiscent of black tea or even the color of cola, and at the same time your stool appears pale, grayish, or clay-like, your body is painting a worrying picture. Let's decipher this message. Bilirubin, that pigment we mentioned, the same one that causes jaundice when it accumulates, has a specific destination in a healthy body. It is processed by the liver, travels through the bile to the intestine and is eliminated in the feces, giving them their characteristic brown color. Think about what happens when a main route is blocked, traffic is diverted. It's the same with bilirubin. When the bile duct is obstructed by a tumor in the pancreas, the bilirubin cannot reach its destination in the intestine. The result? The feces lose their normal color, becoming light or grayish. And what about the bilirubin that didn't go to the intestine? It doesn't disappear. It returns to the bloodstream, and the kidneys, like hard-working filters, try to find a way to eliminate this excess. This heroic attempt overloads the urine with pigment, making it very dark. So dark urine and light-colored stools, especially when accompanied by jaundice, are a symptomatic duo that screams of a problem with the flow of bile. In the context of pancreatic cancer, this can be a strong indication that the tumor is blocking the pathway that bile should travel. It's as if your body's plumbing is clogged, and waste is trying to find alternative routes or simply not being able to exit as it should. Some people may also notice that their stools become oily or greasy, a condition known as stearia. This is because, without enough bile reaching the intestines to aid in the digestion of fats, the fats end up being eliminated in the stool. The stool may float in the toilet bowl, have a particularly strong odor, and be difficult to clean. Don't underestimate these changes. They are not part of your normal health routine. They are clear visual messages from your body indicating that something is disrupting fundamental digestive processes. If you notice these signs, especially if they occur together and persist for more than a few days, it is crucial to seek medical evaluation to investigate the origin of this story. It could be one of the silent but very visual cries of your pancreas crying out for help. Sign 3. Itchy skin, pruritus. The third silent sign that may be telling a story about pancreatic problems is a persistent, widespread itching of the skin, which doctors call pruritus. Imagine your skin, the largest organ in your body, trying to send you an urgent message. Not through a visible wound, but through an internal sensation, an itch that just won't go away. This isn't as dramatically visual a symptom as jaundice, but it can be a torment and, more importantly, it can be another reflection of the buildup of bile in your bloodstream. When bile acids and bilirubin, which should be on their way through digestion, are forced back into the bloodstream by a blockage, as can happen with a tumor in the head of the pancreas, they can infiltrate the skin. There, they irritate the delicate nerve endings, like unwanted guests causing a ruckus, triggering that persistent itch. Itching associated with pancreatic or liver problems usually doesn't present with an obvious rash, like allergies or insect bites. The skin may appear normal, perhaps a little dry from constant scratching, but the itching is deep, stubborn, and doesn't go away easily. It can appear anywhere on the body, but is often felt most often on the palms of the hands and soles of the feet. Many people may initially attribute this itching to more common causes: dry skin, an allergic reaction to a new soap, or even stress. However, if the itching is widespread, lasts for weeks, does not respond to common moisturizers or anti-allergy products, and especially if it is accompanied by other characters in the story we are discussing, such as jaundice, dark urine or light-colored stools, it becomes a much more significant symptom. This is your body reacting to an internal imbalance. It is another, silent scream, that should not simply be endured or treated with home remedies indefinitely. An itch with no apparent explanation that refuses to go away deserves medical attention, as it may be the skin revealing a deeper problem, the origin of which may be in the pancreas or the biliary system. A medical investigation can tell whether this itch is related to increased bilirubin levels and discover the cause of this change. Do not ignore this insistent call from your body. Sign 4. Persistent abdominal or back pain. Pain is one of the body's most common messengers, a sign that something is wrong. In the case of pancreatic cancer, it can present itself in very particular ways. The fourth warning sign is persistent pain in the upper abdomen, which, like an echo, can sometimes radiate to the back. Think of this pain as a low-pitched alarm, almost a murmur of discomfort or a burning sensation in the stomach area. At first, you might mistake it for simple indigestion, gastritis, or other common digestive problems. But this alarm has a different characteristic: it does not go away. On the contrary, the pain associated with pancreatic cancer is usually persistent and can gradually worsen over time. Many people report that the pain becomes a more bothersome companion after meals or when they lie down on their backs. Leaning forward can sometimes bring temporary relief, a momentary respite. The location of the pain can provide some clues. If the tumor is in the head of the pancreas, the pain may be felt more on the right side of the upper abdomen. If it is in the body or tail of the pancreas, it may be felt more in the center or even on the left side. The radiating pain to the back is a crucial detail in this narrative. Imagine the pancreas, nestled deep in your abdomen, close to your spine. As a tumor grows there, it can act as a silent invader, pressing on or even infiltrating nearby nerves and tissues, including the nerves that run to your back. This invasion can be the cause of that pain felt in the middle of your back, described by some as a band-like pain or a dull, constant ache, a presence that won't leave you. It is essential to understand that not all abdominal or back pain is a sign of pancreatic cancer. There are countless other causes, many of them much simpler. However, what makes this pain a worrying, silent scream is its persistence, its tendency to worsen and, especially, if it is accompanied by other signs that we are listing, such as unexplained weight loss, jaundice or digestive changes. If you're experiencing pain in your upper abdomen or back that won't go away, doesn't seem to have an obvious cause, or is constantly bothering you, don't ignore it. Don't just assume it's something you ate, or a bad posture. Pain that persists and doesn't respond to simple measures needs to be checked out by a healthcare professional. It could be your pancreas or the nerves around it, signaling that something is wrong and needs urgent attention. Sign 5. Unexplained weight loss and lack of appetite. The fifth silent sign, and one of the most alarming, is unintentional weight loss, often accompanied by a noticeable decrease in appetite. Losing a few pounds through diet and exercise is an accomplishment, but when the weight starts to drop off without you trying, and the desire to eat simply disappears, that's a serious wake-up call from your body. Imagine your body as a well-regulated house, where energy is spent in a predictable way. Suddenly, without you changing your habits, the scale starts showing lower and lower numbers. This weight loss, when there is no obvious reason, is as if an invisible thief were stealing your reserves, and often, your appetite, your old ally, seems to disappear with it. In the context of pancreatic cancer, this weight loss can be the result of a conspiracy of factors. First, the tumor itself can act as a metabolic saboteur, speeding up the burning of calories. In addition, it can release chemicals such as cytokines, proteins such as interleukin and interferon, which are like chemical messengers of discouragement, causing general inflammation in the body and suppressing hunger. The person simply does not feel like eating, or feels full very quickly after eating only a small amount. Another factor that contributes to weight loss and loss of appetite is the digestive problems that can arise with pancreatic cancer. If the pancreas is not producing enough digestive enzymes because of the tumor, or if the pancreatic duct is blocked, the digestion of food, especially fats, is compromised. This can lead to symptoms such as a feeling of fullness in the stomach, nausea and even vomiting after meals, which naturally decreases the desire to eat. Persistent abdominal pain, which we mentioned earlier, can also play a role. If eating becomes a painful or uncomfortable experience, it is natural for a person to start avoiding meals or eating less. It's crucial to note the word unexplained. If you've started a new diet, stepped up your exercise routine, or are going through a period of high stress that's known to affect your appetite, your weight loss may have a clear cause. However, if you're losing weight for no apparent reason, and the loss is significant, usually defined as more than 5% of your body weight over a period of 6 to 12 months, that's a sign that requires immediate medical investigation. Loss of appetite, or anorexia as it is medically called, can be subtle at first. You may just notice that you are no longer as enthusiastic about eating as you used to be, or that your portions have gradually decreased. But if this lack of interest in food persists and leads to noticeable weight loss, it is a scream from your body that cannot be ignored. It is often one of the first signs that people notice, even before the pain or jaundice become more pronounced. Don't wait. See a doctor to understand what is happening. Sign 6. Persistent nausea and vomiting. The sixth warning sign that could indicate problems with the pancreas, including cancer, is persistent nausea and vomiting, especially if it decides to appear after meals. Your stomach, which normally works in harmony with the rest of your digestive system, suddenly seems to be in constant rebellion. Everyone has felt nauseous or had an episode of vomiting at some point, whether it was due to food poisoning, a virus, or motion sickness. But when these symptoms become frequent, have no obvious cause and persist for a long time, they could be a sign that something more serious is going on in your digestive system. In the case of pancreatic cancer, nausea and vomiting can occur for a number of reasons. If the tumor is located near the stomach or duodenum, the first part of the small intestine, it can grow to the point where it presses on or partially blocks the passage of food. This is known as gastric outlet obstruction. Think of the path that food takes from the stomach to the intestine. If a pancreatic tumor grows near this passage, it can act as a barrier, narrowing or blocking the passage. Food, with nowhere to go, can be forced back up, resulting in nausea and eventually vomiting. Vomit may contain undigested or partially digested food that was eaten hours earlier. In addition to the physical obstruction, the disease itself and the changes in metabolism that it causes can cause nausea. Poor digestion due to a lack of pancreatic enzymes can also contribute to the feeling of a heavy stomach, bloating, and nausea. If the pancreas is not releasing the enzymes needed to break down food properly, it can ferment in the digestive tract, leading to discomfort, gas, and nausea. Another point to consider is that severe abdominal pain, common in some cases of pancreatic cancer, can, in itself, induce nausea and vomiting as the body's response to suffering. It's important to know how to differentiate occasional nausea and vomiting from persistent, worrisome nausea and vomiting. If you vomit once after eating something that didn't sit well, this is usually nothing to worry about. But if you feel nauseous most days, vomit repeatedly, especially after meals, and if these symptoms are accompanied by other signs such as weight loss, abdominal pain, or changes in bowel habits, this is a pattern that needs to be evaluated by a doctor. Those screaming sounds from your stomach could actually be echoes of a problem that started in your pancreas. Ignoring chronic nausea and vomiting can lead to dehydration, malnutrition, and a delay in diagnosing a potentially serious condition. So if your digestive system seems to be constantly in revolt, seek medical help to figure out the root cause. Sign 7. New-onset diabetes or sudden worsening of glycemic control. The seventh silent warning sign, and one that has been receiving increasing attention from the medical community, is the sudden onset of type 2 diabetes. Imagine a seasoned conductor, your pancreas, that for years has been precisely conducting the orchestra of your blood sugar levels through insulin. Suddenly, the melody goes out of tune. This is especially concerning in older adults, over 50 or 60, who do not have the traditional risk factors for the disease, such as obesity or a strong family history. Or, in people who already have diabetes, an unexplained and sudden worsening of blood sugar control, even after following proper treatment, can also be a warning sign. The pancreas, as we know, is largely responsible for producing insulin, the hormone that regulates blood sugar levels. When a tumor develops in the pancreas, it can damage the cells that produce insulin or interfere with their ability to release insulin properly. This can lead to increased blood glucose levels, resulting in a diagnosis of diabetes. Studies have shown that a significant percentage of patients diagnosed with pancreatic cancer had a diagnosis of diabetes in the months, or even a year or two, before their cancer diagnosis. In some cases, diabetes can be one of the first detectable signs of pancreatic disease. It is as if diabetes is an early messenger, a subtle warning that the maestro, the pancreas, is facing serious problems behind the scenes. What makes this a particularly silent sign is that diabetes is a common condition, and not every new case of diabetes means pancreatic cancer, of course. But context is everything. If a thin person with no family history of diabetes who has always had normal blood sugar levels suddenly develops diabetes, that should raise a red flag for doctors to investigate further, including the health of the pancreas. Likewise, if a patient with type 2 diabetes who has always had good blood sugar control with medication or diet starts to have very high, hard to control blood sugar levels for no apparent reason, the pancreas should also be considered in the investigation. This link between new-onset diabetes and pancreatic cancer is an active area of research, and scientists are trying to better understand how this happens. It is thought that the pancreatic tumor may release substances that cause insulin resistance or directly damage the beta cells, which produce insulin. Therefore, a new diagnosis of diabetes, especially if it is atypical in the way it appears, or a sudden decompensation of a diabetes that already existed, should not be seen in isolation. It is a sign that, although it can have many other explanations, can also be a silent cry from your pancreas indicating that something serious is happening. It is essential that both patients and doctors are aware of this association so that the correct investigation can be carried out, making it possible, in some cases, to detect pancreatic cancer earlier. Asterisk risk factors. In addition to the 7 warning signs we have detailed, it is very important to know the factors that can increase the risk of developing pancreatic cancer. Knowing the villains in this story, the risk factors, is not to instill fear, but to arm us with knowledge and encourage us to be more vigilant and adopt healthier habits. Smoking is one of the main risk factors that we can control, and is responsible for a good portion of cases. Quitting smoking is one of the most important things you can do to reduce your risk, as it is like rewriting an important chapter in the health of your pancreas. Obesity and diabetes mellitus, especially long-standing or new-onset type 2 diabetes, are also strongly linked to an increased risk. Maintaining a healthy weight and controlling diabetes well are therefore important preventative measures. Chronic pancreatitis, which is a long-term inflammation of the pancreas, also significantly increases the risk. It's like a long battle that wears down the organ. People with this condition need regular medical follow-up. A family history of pancreatic cancer, especially in first-degree relatives, parents, siblings or children, or the presence of certain rare genetic syndromes, such as Peutz-Jeghers syndrome, are also serious risk factors. It's like inheriting a blueprint that shows areas of increased vulnerability. If you have cases in your family, talk to your doctor about genetic counseling or screening strategies, if appropriate. Advanced age is another important factor. Most cases of pancreatic cancer occur in people over the age of 55. Men are also slightly more likely to develop the disease. In addition, exposure at work to certain chemicals, such as pesticides, hydrocarbons, and asbestos, has been associated with an increased risk, although this link is still being studied for some compounds. Poor dietary habits, with high consumption of processed meats and fats and low consumption of fruits and vegetables, can also contribute to this dangerous scenario. Knowing these factors is the first step toward possible prevention and paying more attention to your body's signals. If you identify with one or more of these risk factors, don't panic, but use this information to have proactive conversations with your doctor about the health of your pancreas and what routine tests may be important for you. While not all cases of pancreatic cancer can be prevented, since some risk factors like age and family history are beyond our control, there are important steps you can take to reduce your risk and protect the health of your pancreas. Think of it as building a protective shield, brick by brick, to actively rewrite chapters of your health. The main one is not smoking. Smoking is one of the most significant risk factors that we can avoid. If you smoke, seeking help to quit is the best investment you can make in your overall health and, specifically, in the health of your pancreas, the strongest building block you can lay. Avoiding secondhand smoke is also important. Maintaining a healthy weight through a balanced diet and regular exercise is another crucial step, like cultivating a fertile garden for your health. Obesity is linked to an increased risk of pancreatic cancer and is a risk factor for type 2 diabetes, which is also associated with the disease. Focus on a diet rich in fruits, vegetables, whole grains and lean proteins, while limiting your intake of processed meats, foods high in saturated fat and added sugars. If you have diabetes it is essential to keep your condition under control by following your doctor's instructions regarding medication, diet and glucose monitoring. Similarly, if you suffer from chronic pancreatitis, proper treatment and regular medical follow-up are essential to minimize damage to your pancreas. Avoiding excessive alcohol consumption is also recommended, as chronic alcoholism is one of the main causes of chronic pancreatitis, which in turn increases the risk of cancer. For those with a strong family history of pancreatic cancer or known genetic syndromes that increase risk, it is advisable to discuss with a doctor the possibility of genetic counseling and, in some cases, specific screening programs for high-risk individuals. Although screening for the entire population is not recommended, for selected high-risk groups, periodic screening may be considered. Finally, being aware of the signs and symptoms we've discussed and seeking medical evaluation promptly if they occur as a form of secondary prevention, which is detecting the disease as early as possible, when treatment is most likely to be effective. It's like having an early warning system. Regular medical checkups, even if you don't have symptoms, are important to monitor your overall health and discuss any concerns. Adopting a healthy lifestyle doesn't guarantee that you won't get sick, but it certainly reduces your risk of many diseases, including pancreatic cancer. Take care of your body, and it will take care of you. We have reached the end of our conversation about the 7 silent signs that your pancreas may be emitting, true cries for help. And so, we explore together the 7 signs that may be true calls for help from your pancreas. We travel through jaundice, which paints the skin as a warning, through changes in the color of urine and feces, which tell a story of blockage, through persistent itching, through pain that refuses to go away, through weight loss that makes no sense, through nausea that disturbs the peace, and through diabetes that appears like thunder in a blue sky or worsens mysteriously. Pancreatic cancer is undoubtedly a challenging disease, a cunning adversary, often diagnosed late because of the subtle and generic nature of its early symptoms, its ability to camouflage itself. But knowledge is a powerful tool, a powerful light. By recognizing these signs, understanding the risk factors and knowing how to act, you are empowered to make more informed decisions about your health and the health of those you love. You are no longer a passive spectator, you become an active agent. Remember, if any of these symptoms persist, or if they occur in combination, you should not ignore them. Don't underestimate your body's whispers. They may be the first warning signs that something needs to be investigated urgently. If you, or someone you care about, is experiencing any of these signs persistently, the bottom line is this: the time to turn the page is now. Don't put it off, don't wait for it to go away on its own. See a doctor. A consultation can answer your questions, start an investigation and, in the best case scenario, rule out something serious or confirm that everything is fine. But if it is pancreatic cancer, early detection significantly increases the chances of successful treatment and a better prognosis, as well as finding an open door to more options and a more hopeful horizon. Your attention and your action can save a life, perhaps yours. Your attitude can, literally, rewrite a destiny. If this video provided you with valuable information, please like and share. You can help spread awareness and alert others who may be ignoring these silent cries. And don't forget to subscribe to the channel and activate the bell for more important content about health and wellness to continue strengthening your journey. Taking care of your health is an act of self-love. Thanks for watching and see you next time.